with the National Council. Under MDHHS updates, we have seen an increase of people walking in or telephoning for services from 15,794 in fiscal year 18 to 23,899 in 19. Of those people that were screened, we saw a decrease in those that did not meet. So more people are meeting eligibility for CMH services. We also saw a decrease in those referred out. Our no-show or dropouts remains pretty low at 1.5% overall. For Midstate Health Network, our funder, we're pleased to announce that Midstate earned the fiscal year 19 performance bonus incentive pool funds, and those monies are distributed to the CMHs within the region. These are considered local dollars. We had an audit on our delegated managed care functions and a review of our corrective action plan from our last audit. There are no findings of non-compliance. And that would be the end of that report.
Shannon, are the doors open or are you doing everything strictly by appointment? And maybe I missed that, but.
So we are doing, I'm sorry, go ahead.
Well, I know our doors are locked here at the county. I guess I was wondering how you're dealing with that.
So we have support staff on site in the event that something is needed. We have staff there providing injections for psychotropic medications. We also have staff there on Fridays if a person needs to be seen in person. For example, a person who does not have technology or the ability to do a telehealth appointment, we're scheduling them on Fridays and they're coming into a clean room with PPE and being seen through a piece of technology in our building.
Okay.
Majority of services are happening through the telehealth, just for safety of the staff and for the individual receiving services.
Right. Okay, thank you. Anyone else have questions for Shannon?
Yes, this is Bruce Caswell. Shannon, what is the situation in terms of getting patients who suffer from mental illness out of the emergency room to residential facilities? I know that you were working with Reading Emergency Unit. Can you give us an update on that?
Yes, Mary Beth and I met with Reading Emergency Unit maybe a week or so before this happened. We have set up a process for them to provide an invoice mechanism to us as a secondary payer, and we are sending out a contract amendment for them to assist in covering some of that secondary coverage through millage dollars.
Have things gotten any better since this happened?
I have not received any requests for any secondary dollars. I can tell you just anecdotally watching the data, not many people are going to the emergency room. I have not received any requests from Reading Emergency Unit for any type of additional funding at this time. So my just anecdotal guess at this point is that they haven't had an issue during this time of COVID.
Thank you.
Bruce and Shannon, your comments that would correspond with what JJ reported in our meeting last week with the emergency management team. People just are not going to the hospital. And quite frankly, Reading Emergency Unit had reported a patient that refused to be transported to the emergency room, but yet they were called out on the call. So, you know, I think there's a little bit of a fear factor right now, but the hospital might be the cleanest place there is right now. So it's just something that's going to take time. And I think probably even mental health patients are avoiding the hospital. So,
yeah, many of them are using our crisis hotline right now and our mobile crisis services for any supports that they need.
Maybe that'll carry over and we won't have so many walking into the ER. We can only hope, right? Any other questions for Shannon?
Mark, I had a question about service, how are those continuing at this time?
We are using telehealth to provide some services. I believe they're providing crisis services. We are providing psychiatric services all through telehealth.
Thank you on that. Namu, you had a question?
Yes, hi Shannon, this is Namratha Carl. And I just wanted to ask a few in regards with the mobile crisis services. Has that been on the rise?
We are seeing more utilization of crisis services right now. And my guess is people don't want to leave their homes, but are feeling in need of some supports. And so we have a crisis hotline that people can call. The state has set up a peer support hotline, and then we have our mobile crisis services. So my guess is people are not wanting to leave their home, but are still in need of crisis services. And so they're utilizing the telehealth or the phone options right now.
Shannon.
Any other questions while we've got Shannon on the line? All right. Well, I guess that brings us up to date, Shannon, and I'll send you or Mary Beth the information because we're probably going to be online again next month with the stay at home extended through the 15th. And you're more than welcome to participate when we do the appointment. So, and I'm also sure that if Julie or Ruth have questions in their interview process, they will get with you. So.
Thank you.
Yep. Thank you, Shannon.
Yep.
Have a good day.
You too.
All right. That brings us up to committee reports. Bruce, you're first up.
Thank you, Mr. Chairman. I listened to a MAC webinar and it concerned court funding. And Marnie has mentioned this to us before. Basically, what this Supreme Court Administrative Office wants is total state control of all the court funding. They want uniform technology access to all data so that data all over the state would be put into the same system. They want uniform assessments and centralized collections. Would not necessarily, courts would not collect their own money. It would all be done in probably regional centers around the state. All court employees would become state employees if this passes. And currently there is a sunset that will take place in October when courts would no longer be able to levy costs when they're allocating out fines and so on. The legislature is going to have to act on that, or that will end and there won't be any costs coming back into the county. Having said all this, that's what the state wants to see. It was made plain at the end of the webinar that with what's going on with the reduction in revenues up in Lansing, that it's not going to be a particularly viable thing to do this in the next couple of years. My second thing is a question that doesn't need to be answered, but we talked quite some time ago about evaluations of department heads. And I and the rest of the commissioners have never had anything brought to the commissioners about what was done, what were the strengths, what were the weaknesses, and so on of our department heads. And I wondered if and when that's going to be done. Next is Derek on the phone? Okay. I asked Derek to prepare for us a rough analysis of what's going to happen in terms of revenues in the county. I know from some webinars that I was on, our county revenue sharing numbers do not depend upon the sales tax. Our county revenue sharing is a line item in the state budget approved by the legislature and the governor. To change that line item, they're going to have to go in and do that. They may very well do. It appears that the state is going to be about $2.6 billion short in their general fund budget for this year that we're in right now. They're looking at next year, fiscal year 21, at being $3.2 billion short. Derek did an analysis for us, and he's indicating the following items. We're going to be about 55,000 short in the register of deeds. Probate court, we're going to be about 5,500 short. District court, 21,000. Circuit court, excuse me, 5,000. The clerk's office, 8,000. And he's estimating a 10% reduction in revenue sharing, which would be $100,000. I suspect that it may end up being more than that. But our revenue sharing payment that we're going to get at the end of April, we're going to get because no change has been made. But we may see some significant reductions in the future revenue sharing payments for this fiscal year. So with a 10% reduction in revenue sharing, we're looking at being about $200,000 short in our revenue for this year. Okay. Now, I also asked him to prepare for us an analysis of where we're at after the first 3 months of the year. And after the first 3 months of the year, which is 25% of the year, we are at 23.5% of our budget. So we're under, and that amounts to about 190,000. Now that's just about the same place we were last year at this time. So there's no line items that are way out of line without having a good explanation for it. He has this material and it looks pretty much normal. Now for the 19 budget, we have to have our audit done. We cannot get an extension of it. They made that plain in a webinar. We can ask for 30 days, but that's a standard thing that's always been there. There's no extension beyond that. So we're going to have to get our audit done and taken care of. I asked Derek to do an analysis for us this year for the 19 budget. In the original budget that we put together, we anticipated spending $12,430,000. $12,430,000. We anticipated that the revenues would be the same amount. That was the original budget that we passed in December of 18. We actually ended up spending $12,460,000. That's $30,000 more than what we anticipated spending. Now, in that, you need to remember that we had a $110,000 bill come in workers' comp for the deputy that was seriously hurt. If it had not been for that particular item, our expenditures would have been about $80,000 below what we originally set in the budget, which I think speaks very highly to the work that Derek did in putting together a very accurate budget. Now, our revenue, remember we anticipated originally at bringing in $12,430,000. We actually brought in $12,295,000, which is about $135,000 short. But if you remember, that was entirely caused by the reduction in the personal property tax reimbursement from the state. They changed how they reimbursed us. We didn't know about that till after we had already finalized that budget. So that item is taken care of for this year. We're no longer anticipating more money than we're going to get. So we ended up, basically, we're going to end up about $165,000 in the hole. That's Derek's estimate. Now, the audit has not been done. We don't have final figures. But I just wanted to give all of you a heads up to where we anticipate being and why we're in the hole. And it's primarily the two items: the workers' comp for the deputy who was seriously hurt, and the reduction in personal property tax revenues from the state of Michigan over what they had given us originally. Now, before I go on, are there any questions from anyone in regards to those items? Okay, now, Mr. Chairman and Commissioners, I think it would be wise, and I'd like permission to go ahead and do it, to start taking a look at any and all expenditures that are unnecessary for this year. The state is going to get about 3.1 billion from the feds for COVID relief. How they spend that and what they do with that, I can assure you they'll take care of themselves up in Lansing first. And I think it would be very prudent on our part to start identifying everything that we can in terms of unnecessary expenditures or things that could be put off and so on. So I'd like your permission to have Derek start working on that, putting together some kind of a analysis and bringing back to you that analysis so that you can ask questions and peruse it. Would that be okay, Mr. Chairman?
I see no reason not to.
Okay. The next thing I wanted to mention with Lifeways, and I didn't hear Shannon talk about it, but they have now obtained a license for outpatient services for substance abuse. And that means that's a requirement of this huge grant they're trying to get to create a community behavioral health care center. So that's a good piece of news for them. Another webinar that I listened into indicated that revenue sharing, sales tax money coming into Lansing is going to be down about 50% in April and May. And it's not going to come back up to the expected levels probably for the rest of the year. So the townships, the cities, and the villages who get revenue sharing through the sales tax are probably going to see significant reductions in their sales tax money and their revenue sharing. They also indicated in this revenue that traffic volumes around the state of Michigan are down these past 2 months, 50 to 60%. That's going to have a significant impact on the amount of money that comes back to the County Road Commission because people aren't buying the gas, and so the tax money is not coming in. So I just wanted to give you a heads up on that. The final thing that I wanted to mention from this webinar is that we potentially could be eligible for FEMA grants to help us with any unexpected COVID expenses. In order to be eligible for those grants, we had to register on the federal portal website by April 30th. Doug Sanford has done that for us. We are now registered. Now, I don't know whether there'll be anything that we can access, but at least we now have the potential to access things because we're registered. If you get any of these grants, we have to come up with a 25% cost share. So if we ask for $100,000 for something, we've got to come up with $50,000. The feds will give us the other $150,000 if they approve it. Okay. And they talked about what could be eligible. And this is not an inclusive list, but overtime, mutual aid. And if we do any of these things, we've got to keep meticulous records of anything that we want to apply for, because the feds are going to want to see everything. Otherwise, they won't approve it. So just a heads up as we move forward. I already mentioned the audit. And we need to, again, I'll get with Derek, and by the next meeting, we will have a list of things that we believe that we could freeze as far as expenditures go until we get a better handle on what's actually going on. Indigent defense system is anticipating continuing to get the money that they're getting, that we're getting. Now, that's not a guarantee, but they're anticipating continuing to get that money, and they're asking us to work together with other entities. We'll see how that works. I have questions, Mr. Chairman, on the pension. Where are we at with that as far as moving forward with it, and what we're going to do, and where we're at with negotiations and so on? So that was a question for me. I also had questions on the policy manual that was put together quite some time ago, and we haven't talked about that since. I just wanted to know where that's at. And then finally, where are we at in terms of the bids for the heating system in the courthouse? Do we have them all? Are we ready to look at them, and so on? And are we going to move ahead with it? Or under the circumstances, are we going to back off? So that's all I have. Thank you.
Let me address the bids. I believe we had given Randy direction to bring that before us on May 12th. Jody's checking the minutes right now, but I believe that's what I had directed.
Those bids come before the board on May 12th.
Thank you. Jody just verified that.
Okay, and Mr.
and
Chairman, in that regard, I think it would be very helpful if those bids were all sent out ahead of time to the various commissioners so that we have time to look at it before we get to the meeting.
Julie, can you make sure that that happens so that everyone has a chance to look at those?
Yes, I was going to address that in my report, but that's fine. It's been addressed.
As long as we're discussing that. I do know that I got some masks for Randy, and he did have people in here Friday, and he had some people in here, I believe, yesterday. And I provided him with masks so that we had, you know, the people that were in our building mask up.
Thank you.
Wednesday last week as well.
Okay, the only other thing, I guess I got a resolution I got to go over. You want me to do that now?
Well, hold on just a minute. I wanted to address one of your other questions before you do that action item. The pensions negotiations, I think, you know, you and I and Derek have been working on that issue, but due to COVID, that's pretty much stalled out. So as soon as we've got the restrictions lifted, we need to get going on that again. Negotiations really officially don't have to start until later this fall. Really, I'd like to have them done by the end of the year, but the current contract extension takes us through the end of March. So we're not in desperation mode, I guess is what I'm telling you. So, but just as soon as we can, Bruce, you know, safely meeting, we'll get going again on looking at the, on the options as far as what we want to do with MERS or 401 or whatever the case may be. So.
Okay, thank you.
And with that, you may take up your action item, please.
Okay, we got resolution 20039 to the Honorable Board of Commissioners. We recommend approval for the county treasurer to adopt the attached cash over and short policy, increasing the amount of overages and shortages on property tax payments from $1 to $5. Respectfully submitted, Bruce Caswell, and I move for the adoption of this resolution.
Support. This is Ruth.
Okay, Mr. Chairman, what
Go ahead.
this is, and Stephanie can correct me if I'm wrong, but I talked with her. What this is when she receives property tax payments from people, this is primarily payments that are late and there's interest and penalties and all that kind of stuff on it. A lot of times people will figure out for themselves what they think they owe and they will pay. And they're always very close. It's not like they're doing anything wrong. But the current policy is if there's more than $1, if they're more than $1 off in either direction, then if they overpay by $1, then Stephanie has to put together a list of those, take them over to Carol. Carol has to write up checks, run it through the process, run it through the whole payment processing thing, and then send out letters to the people with the checks in them. If they're under by more than $1, then Stephanie has to do all kinds of paperwork for purposes of the audit to bill the people and to get the money out of some account that she has, and it's a ton of paperwork for her. She indicated that she requested the $5. She indicated that most of the mistakes are within $1.50 of one another, either over or under. And she indicated that if we moved this to $5, it would be a huge amount of less work for Carol over in the clerk's office, and an awful lot of less work for her in the treasurer's office. There would be just a few of these things that would have to be adjudicated or taken care of. And if you think about the fact that it costs 55 cents to send out a letter, and the time of Carol, and the processing to print the checks and so on, this hasn't been changed in years, and this is an attempt to get it in a more logical manner and eliminate an awful lot of cost and time and effort. So that's the purpose behind it.
Good explanation, Bruce. Any questions for Bruce? Yes. Hearing none. Roll call vote, Jody?
Commissioner White,
Yes?
Commissioner Caswell,
Yes.
Commissioner Carolyn,
Yes.
Commissioner Brown,
Yes.
Commissioner Gaines.
Yes.
Resolution passes 5-0. Thank you. Anything else, Bruce?
Nope, that's it. Thanks a lot.
Thank you. I would please remind anyone that's on the call in listening, if you would mute, please. It kind of helps as far as feedback. Thank you. That brings us up to Ruth. Ruth, before you, or you and Bruce could do it together, there was an update on the agenda as far as the monetary discussion on the wages, the part-time position.
Yes. Have Bruce talk about that.
Well, Ruth and I talked, and we believe that the general policy moving forward, any resolution that we make to eliminate positions, add positions, et cetera, should never have anything in it concerning monies, what we're going to do with the monies. When we pass the budget at the beginning of the year, the monies are allocated. And at the end of the year, there are adjustments that can be made and are made to every budget in order to bring it in line for Derek's purposes for audits. And so we just think it's very poor policy on the part of the county to pass any kind of a resolution and then specify how monies are going to be spent. So we believe that should not be part of any resolution going into the future, including the one we're talking about.
Okay. So that's more of a housekeeping issue, but we need to adhere to that going forward. Okay. Please continue, Ruth.
The Hillsdale County Community Foundation has created an emergency relief fund to address the immediate needs of our most vulnerable community members during COVID-19 crisis. This is going to go through the nonprofit. So the community foundation with this fund will be able to make emergency grants to local nonprofits and respond to those needs. We'll also be able to operational expenses for the nonprofit will be permitted from this fund. So there's two things. One is if you want to, or if you know somebody in your district, and go ahead and write a check out. You're looking for donations to fill up this fund. Hillsdale Community Foundation for the Emergency Relief Fund, Hillsdale County. And the contact person for the foundation is Sharon Beischer. Okay. Now the other part of it is they are doing a survey I'm gonna participate in, and it has to be done by Friday. So I'm working on this. They're trying to make connections with what the local needs are here in Hillsdale County. So what are the greatest needs? I know right around in my district and probably all over Hillsdale County, but I'm looking at around my district specifically right now. There has been a need for baby food and baby formula. And when families go to the food pantry, there's plenty of food, but there's quite often not, baby formula and baby food. So that's one thing. There's other needs also, but also not just emergency needs, but if possible, thinking about what might be needed in the next 6 to 12 months. So if you know of needs in your district that could be taken care of with this emergency relief fund, please let me know and I will put it on the survey. I have to turn it in on Friday to the Community Foundation. And other than that, I've been working on suicide prevention and depression support. Depression support has elevated to the next level here and needing daily. We were doing it twice a month, and then we went to once a week, and now we're doing it daily right now. And we're doing it by text and by phone. So unless there's any questions, that's my report.
Any questions for Ruth? Hearing none. We will proceed to Commissioner Cleveland. Your turn.
Yes, thank you, Mr. Chairman. So the townships have been meeting virtually, and concern was when they would be able to resume back, and we're still having meetings virtually to be on the safer side. And to start with medical examiner, I will be having a virtual meeting possibly, unless things change in due course in early May, and to find out some more information, but they are still scheduled to have a complete transition of their morgue on August 1st, 2020. As you probably have already heard, that we have not met or convened in person. And when we do have this opportunity to next meet, we will be working on a plan as proposed, which sunsets next year, 2021. And we look forward to completing it. As of now, the townships who are in the process of adopting any new plans, master plans, zoning ordinances, they all have been sent letters, postal letters, and they are working. Them have already worked on adopting, and they will be sending in information with their new master plans or anything that they have updated as it relates with the zoning ordinance to the county, so that we can update our master plan when we're working on it. Moving forward, I did have an opportunity a couple days back to attend a webinar with the state, local, tribal leaders following up with the COVID-19. It was a national briefing, and quite a learning experience there. So it was a virtual meeting, and it was quite a bit of information was provided. And a couple of information that were provided some of them were also covered by Commissioner Caswell. And some of the information that I jotted down was very interesting as it relates with the program plan for the Paycheck and the Healthcare Enhancement Act. That was signed with the new legislation with the President Trump, into law, and to further assist American businesses and workers, which includes the healthcare providers as well. And that particular legislation provides about $310 billion in additional funding for the Paycheck Protection Program. That is the PPP. And the $60 billion more for the Small Business Administration, and also the Disaster Loan Program, about $75 billion in funding for hospitals and healthcare providers was also talked about, and $25 billion to support our nation's testing efforts. A couple of more things I would discuss when I participated in the webinar, which was very educating. One of them was a comprehensive strategy to revitalize the communities that are hit hard with the coronavirus, and that was Wednesday, 22nd. And the president, he did iterate about announcing about the administration, which is implementing a comprehensive strategy for distressed communities. And the administration also target resources to the communities and take some more measures, which includes providing more support for the community health and its centers. And a couple of more things were discussed, which I found it educating again, was a couple of coronavirus relief fund guidance from the Department of Treasury. And that was discussed April 22nd. I participated in that. It talked a little bit about the legislation, which I just talked a little earlier about by President Trump on March 27th. Those use of funds are necessary expenditures, and it talked about incurring all those expenditures that were incurred due to the public health emergency with respect to the coronavirus disease. And it talked a little bit about examples of eligible and ineligible expenditures of the $150 billion coronavirus relief fund. A couple of more things were discussed on the IRS release state by state figures for economic impact payments as well. A little bit about how to combat the pandemic in the rural communities. And as you know, and everybody's aware that we are a rural community as Hillsdale County is concerned. It talked a little bit about some investments which will support nearly 1,800 small rural hospitals and provide additional funding to 14 health resources as well, which is the HRSA funding. Telehealth resource centers as well were discussed. A couple of things were discussed as it relates with the COVID-19 telehealth toolkit to accelerate state use of telehealth in Medicaid and CHIP. A little bit was talked about as it relates with coverage policies in the Medicaid and children's health insurance, which is CHIP, and many public are aware of the CHIP program. And during the 2019, this current year novel coronavirus COVID-19 pandemic, these released bills on the agency's swift actions to provide some states with wide range of tools and guidance to support the ability for the care for the Medicaid and CHIP beneficiaries. A couple of things were discussed about Medicare and Medicaid services as well. And I found it very educating again as I participated in the webinar. And again, a couple of things were discussed as it relates with the CDC that announced new regulatory requirements that will require nursing homes to inform residents and the families, representatives of the COVID-19 cases in their facilities. And CMS will now require nursing homes to report cases of COVID-19 directly to the CDCs, that is the Centers for Disease Control and Prevention. And also it was reiterated and talked a little bit about CMS will also require nursing homes to fulfill or fully cooperate with the CDC surveillance, I believe, for efforts around the COVID-19 spread. And now some more things it relates with the U.S. Department of Education, and a lot of concerns. A couple of my constituents asked about it. I shared this information. The U.S. Department of Education makes available over $13 billion to support continued education for K-12 students. And that was discussed on the 23rd. The U.S. Secretary of Education, they announced more than $13.2 billion in emergency relief funds, and which are available for the state and local education agency to support their continued learning for K-12 students whose educations, as you can only imagine, have been severely disrupted by the coronavirus. A couple of more guidelines were talked about as it relates to reopening America again. So that was really soothing to hear about that as we start slowly and steadily with CDC guidelines that we can adhere to and social distancing. So a couple of things that was talked about, that we will get through this and continue the robust coordination outreach with the state and local tribal leaders and collectively to work together to reopen the country slowly. But on the county side, I think we're doing it and we're doing it slowly and steadily. So that is great. And we look forward to convening in person, I suppose. And I look forward to my couple of other meetings in the townships, and they are hoping to convene possibly in person, spreading out. A couple of the townships are looking forward. One of them is Wheatland Township, and I look forward to visiting them. Hopefully, if they will be visiting, convening in person, I look forward to attending those meetings in a couple few days. So with that, I'm done with my report. If there's any other questions or any questions at all, I'd be happy to entertain them, Mr. Chairman.
Questions for Namo? Hearing none, we'll move along. Thank you for that.
Thank you, Mr. Chairman.
Julie, that brings us up to you.
Thank you, Mr. Chairman. I'll start out by I had a discussion topic on there that was more of a reminder than anything else, that unlike many things that are shut down right now, the state did not shut down farmers markets across the this farmers market will be opening on May 9th, a week from Saturday. They have the protocols from the health department and are fully prepared to serve our constituents and be available with fresh farm goods there at the market. I also had a Parks and Road Commission meeting this past week, and as in many things we're going to find throughout the county budget, the revenue is down at the parks due to the events being canceled for the community center, because they're not allowed to, have large gatherings under the COVID-19 rules.
Interestingly,
And, also, they're continuing to clean for spring, so that when the parks are appropriately able to open, they will do that. We'll have some nice donations from citizens who wanted to memorialize people that they've lost this year. One citizen would like to put up a bench at Lewis Emery Park, which would be very nice in remembrance of someone, and another group organization is donating a tree in remembrance of another citizen. Also, the Parks Commission received a grant of $1,500 to repair the docks at the rearing ponds. So that was nice to hear. Moving on to the Road Commission. The Road Commission was closed April 6th through the 20th. They did close for 2 weeks. During that time, drivers were on call, and they helped and came in with things like down trees and power lines, etc., snow removal, those type of things. Reopened with safety protocols to their trucks. They're using social distancing members when they're inside buildings, etc. And so the union steward for the employees was there at the meeting, and he thanked the Road Commission and the director, John Sanders, for the safety protocols and protecting the employees. Also, as Bruce alluded to, the Michigan Transportation Fund is from the gas tax. It accounts for approximately 90% of the road funding, and they are projecting a loss anywhere from $700,000 to $1 million this year because of the lost revenue from the gas tax. Next, I want to move on to Michigan Works. We did not have a meeting. Our meeting was canceled. However, I did forward to you the March report for unemployment. And just as an example, unemployment filings averaged between January and the middle of March about 166 filings a week. The week ending March 21st, it was up to 331 filings that week. And by the 28th of March, they had 1,681 filings. So unemployment is a huge, obviously, concern in the county, up over 1,000% from normal filings during this COVID-19 epidemic. Moving on to facilities, Randy informed me this morning that one of our employees, Mark Shirey, has given his notice. And so he's taking a better paying job elsewhere. And so we will need to give Randy permission to post that position and look for a replacement for Mark. We will miss Mark in the department. Randy did take several engineering firms through the courthouse. Well, he took several before, one last week, and was expecting 2 more to go through. So he should be obtaining more bids for us, and I will make sure that we get those in a timely manner so that we can review them before the next meeting. Many of you probably know that a piece of the stone siding from the courthouse fell off the top up by the tower and did some major damage up there. And that has been turned into the insurance company. Esther has been out to inspect the damage, and I'll have a better report on that as far as what the insurance will cover at the next meeting. Also reporting on the Ambulance Association, the second payment due from the millage was due on the 15th. All the reports were turned in as promised, and those checks were distributed. Most of my other committees and so forth did not meet. So that'll be my report unless people have questions.
Julie, a couple things. One, did you want to move at this time to authorize Randy to post that position?
Yes, I do. It's urgent that we get that replacement as possible. So I would make the motion that we give Randy permission to replace the position in his department.
I support that.
I guess I would comment that if we don't fill that, the work in the courthouse is going to be greatly hampered.
Yes.
So is there any further discussion on authorizing him to refill the vacancy created by Mark's departure?
Mr. Chairman, I have a question for you.
Please.
In regards with this position, are we still going to pursue the part-time position?
Yes. We've already,
28 hours.
yeah, we've already granted him permission on that. I don't know. I believe it was posted, but I don't know that for fact. Julie, do you know?
Yes, it was posted, but don't have any, I don't really have an update on that. I don't believe he's even interviewed anybody for that position yet.
Okay.
Well, as far as I remember, last meeting when we had asked Randy, and he mentioned that it hadn't been filled yet.
Correct. It's very difficult to interview under the current state of home order. He's going to have to figure it out, though, to fill that full-time one, as far as whether he uses WebEx or Skype or whatever, but he's going to have to, yep. So, any other comments or questions? Okay, Jody will do a roll call on the motion to allow Randy to post that full-time position. Please go ahead, Jody.
Commissioner Caswell,
Yes.
Commissioner Carolyn,
Yes.
Commissioner Brown,
Yes.
Commissioner Gaines,
Yes.
Commissioner Wiley.
Yes. Thank you. Julie, you can let him know that passed 5-0 and we can get on that hopefully.
Thank you.
Question I had or comment, I guess, is I know I sent you the farmers market information page that the health department sent. I forwarded it to the other commissioners just a few minutes ago.
Yeah.
That is probably outdated considering the current stay at home order, because the first part of that says they can't sell plants or plant cuttings. The fact that she's opened up nurseries and such. So Julie, I would encourage you to reach out to those folks from the market and have them check MDARD's webpage for an updated version of that.
Yes, I've been in touch with Krinsky, who is the one of the operators, and she's come before us previously, and they're on top of it. They're doing a really good job.
Now, one thing I heard, Julie, and I don't know if this is true or false, but I heard it from somebody that was up to the Marshall Farmers Market, which is, or maybe it was Battle Creek, I can't remember, one of them. But that particular market is not allowing the shoppers to touch the produce. They point at what they want, the vendor picks it up, puts it in a bag, so that you don't have something being handled by multiple people. In other words, if they pick it up, look at it and sit it back down, that piece of produce could then end up to somebody else that didn't originally touch it. So you may want to talk to them about that. It sounds like a good idea.
Okay. Definitely, I'll follow up on that.
Myers and that are just terrible, but Jody just made the comment that they need a better policy at Myers or Walmart or the other grocery stores, because people are doing it there, and quite frankly, it's a little disturbing.
Yes.
So we just all need to practice best practices for not only our own safety, but for the safety of our fellow man or woman. So, but any other questions for Julie?
I have a question, and
Go ahead.
if I may, Julie, I just have
Go ahead.
a question, but I'll go with the comment first. I really think, the farmer's market is such a great privilege, for, mothers and children. And, it's really essential that children pick nutritious food. And it's such a great time frame. The only sad part of everything is that during this time, we do have to realize to, keep ourselves at bay, wash your hands, wash your fruits, vegetables when you get it back home. But nothing like the farmers market. It's such a great privilege to supporting healthy communities and obviously promoting sustainability. I feel that if we do happen to open up at the right time frame with all of this, my comment is, will we still be able to have it at the same time frame and the date that's been given at the moment for the farmers to open up at the place that they're supposed to open?
They're not changing. They were originally scheduled to open on May 9th, and they do plan to open. That's a week from Saturday. They do plan to open that day as scheduled.
Okay. Could you just reiterate the date? Is it May 9th? I'm sorry. All right. And the other question I had, Julie, was in regards to the unemployment. I know you mentioned a little bit about it, and it's a huge concern. And I have been approached by several constituents who are finding it very difficult. That they've written several letters to apparently the representative Eric Leutheser in regards with it. And there's a huge time frame as it relates with the gap. Do you know when the unemployment issues, as it is a big concern right now, almost 1,000% increase, I believe.
Julie, you still there? Lamu, I think we, Julie, are you still there?
Julie's there, but she's muted. She lost her microphone.
Mute. Yeah, Julie, I think you're on mute.
Now,
There you go. Go ahead.
I might be able to address the unemployment issue a little bit. I've been working with the unemployment and with Janet Myers, who's the head of the Hillsdale Service Center of Michigan Work.
Okay.
And I was able to help one constituent get unplugged a little bit. I went through Janet Myers, and then she turned me over to Erica, who works at the Hillsdale Service Center, and one constituent get through. But the fact of the matter is that Michigan is one of the fastest states that has been getting through, and we're doing good here in Michigan. Now, it doesn't seem like it to somebody who's waiting for unemployment. I realize that, but you have to practice patience. It takes at least 3 weeks from the time you apply to actually get anything, and maybe longer. But you just have to stick with it every day and check it and make sure you're following all the steps and uploading all the documents. And the best way to get through to them is to send a message through their the way to send a message on their site. And they usually answer right back. They do things at night, and you usually get an answer back the next day. So that's the best advice I can give. If somebody is really plugged up, have them contact me, and I will contact Janet and see if they can help them. I did able to do that with one constituent. I'm trying not to do that, but in extreme cases, this was an extreme case, I did do it. Is that
Yes, thank you, Commissioner Brown, for your comments. Yes, I'm also hoping, because some of the folks have been past 30 days late with receiving any kind of information, but they have been in touch with, I have asked them, and they have been doing it quite diligently in contact with Eric Leutheser's office, and some of them have been getting some help, but this has been a major concern, and seems like it is a concern, and I am looking forward for it to be solved, because I'm concerned about some of the constituents who have been laid off for quite a while and received no unemployment at all. So we just hope.
Two different things happened that helped, and one is that the governor Whitmer instructed that Jeff, he's the head of the whole unemployment, and he instructed her, or she instructed him rather, and they hired a whole bunch of people. Michigan Unemployment hired a bunch of people, and they're working all night, determinations at night, and so if you check it in the morning, that's when quite often you'll get a reply from them. So to push payments out, so as fast as possible. So if you check your bank account in the morning, quite often see deposits from unemployment in your bank account, and then I'm getting calls from constituents saying, I got something, but I don't know what weeks it's for. You know, I'm not sure. They will write a determination and an explanation on your site. Right now, I'm just trying to get payments pushed out as fast as they can. So if they check their bank account, they might see a deposit and not know what it's for, but a day or two later, if they check the My website and check their account, they will get under certifications what that was for will be there. But their priority right now is putting money out as fast as they can to people. I'm quite proud of our Michigan unemployment system. We're one of the tops in the country for how fast we've been able to push things out. But I realize it's slow for people who are waiting for it. I understand that. It takes at least 3 weeks the time you apply to get anything, and maybe more than
Yes. Thank you, Commissioner, for the valuable information I have written down. Now, would be happy to share with the constituent. And it looks like, oh, yes, you are correct, and we're all working towards, I hope, getting resolved. It is certainly taking some time, but I think it will be definitely looked at, and I am hoping for some closure soon for these much needy families. And so thank you so much for that insight. I appreciate that. I'd also want to thank Commissioner for giving quite a bit feedback about the farmers market and about the road commission being closed for 2 weeks. But my question, Commissioner, to you is the 2 weeks that they were closed, do you know if they were doing any other work as it relates with attending to, road construction or pothole fill or whatever? Because I did see some of the work that was done, even though the office is closed for over 2 weeks. I know that for the public.
Julie, are you back on? I think Julie's having muting problems or something. Julie, are you still muted?
I can't hear you.
Well, the short answer, Mo, is that they were not doing anything over that 2-week period unless there was an emergency. Julie? Yeah.
Still
Technical
can't hear.
difficulties.
Yeah, that's all right. It's okay.
She'll have to
Yes,
call in.
They were strictly on a call-in basis. It was emergency only. So basically nothing was done. They are back out scraping roads and starting to work on things and practicing, as Julie indicated, social distancing and best practices. So.
Okay. Thank you, Mr. Thank you all for your insights.
Just to add a comment there on I've watched several of the governor's addresses, plus I've seen it on the news. As far as the unemployment, they have asked that if you have general questions or general emails or looking at your claim, to try and do it in off hours. If you're filing a new claim, do it during regular hours, but anything that's outside of a new claim, try and do it between 8 p.m. and 8 a.m. Their system, much as David has told us before, with our bandwidth and servers and stuff around here, the state of Michigan is having trouble as well. So that would be another thing to tell your constituents, Namu, is that if they've got just generalized questions or they want to view the page, do it in off hours. So,
Off hours.
Yep. So anytime,
Thank you, Mr. Chairman.
8 p.m. and 8 a.m. is what they're calling off hours. They are open Saturdays. I believe it's until 2 p.m. So they're Monday through Friday, basically 8 to 8 is my understanding, or 8 to 6. And then they are open, I believe, from 8 to 2 on Saturday. But trying to get through on the phone is nearly impossible. But I'm not going to say don't try it, but they are overwhelmed. So.
for that insight as well, for that time frame you gave me. I definitely will be happy to share with the individuals who have asked.
Thank you. Um, So as I mentioned earlier, Julie and Ruth are taken care of. I've sent them the questions that Mary Beth provided to me. They're going to take care of the interview. I've told them to reach out to Mary Beth or to Karen if they had any further questions. I have asked them to have that sent out to everybody ahead of the board meeting so we can look over their notes, and they will provide their recommendation as well as a resolution for the May 12th meeting. Tomorrow morning, I have a scheduled with elected and department heads. I've done that a couple, 2 or 3 times now, discussing, of course, COVID-19 and where we're at and where we're going. And of course, we all know we're staying at home, so things probably will remain generally the same as we have around here until the 15th. I also tomorrow have another emergency management meeting, which we host weekly with city, village leaders, as well as the police chief, sheriff, hospital, Doug Sanford, myself, and of course, medical care. And I'll try and give you an update on that tomorrow afternoon. The VA has postponed their meeting. It was originally scheduled for May 11th. It is kicked back to May 18th. And at that time, we'll try and deal with the scholarships as well. If you know of someone that is, that scholarship app is online on the county webpage, that is. And those are due by Friday, May 1st. After that, we probably won't consider, but there may be a little leniency considering the current situation. Someone needs to mute, please. I've talked to Bruce briefly about crisis pay. The union that represents the sheriff deputies has talked to me. I want to bring this out basically as a discussion item. I would like Bruce and Derek to bring something back to us in regards to what it would cost on the people, being the sheriff's department deputies, clerks, treasurers. It's going to have to be a countywide policy and a plan. There are several things. And Bruce, let me know if I didn't forward that fact sheet that the union had sent me. I will send it to you if I didn't. Same way with you, Derek. If I forgot to send it, or if it didn't get sent through, let me know and I'll send it to you again. Send me a sheet with about 3 pages worth of examples of what other municipalities are doing, other counties. I do know a lot of the local grocery stores and other essential businesses have tacked on anywhere from $2 to as much as $5 additional per hour for hours worked by essential people.
All right. You and I'm gonna run the shirt. You walked up to us and not gonna go.
Whoever's talking and not muted, please mute. So along those lines, I would like you and Derek to look at what it's going to cost us if we give $2, $3, give us some options and come back with something that we can wrap on. And then it would have to be retroactive to when this started, as to the number of people. And I think what we need to look at is something on a per hour Bruce and I have talked about this. He saw it on a webinar. Doug and I checked it out. This is not something that will be FEMA refunded or federally refunded because we did not have a policy in place prior to January 20th. So this is going to have to come out of fund balance. It's probably the right thing to do. It's a tough call because of the money issue, but it is the right thing to do because we've got people working on the front line and other people within society are getting those type of payments. So we need to take a serious look at this, have it on the agenda for Bruce and Derek to explain to us at the next meeting of their findings of what the total dollar cost would be on $2, $3, or $4. And quite frankly, Bruce and Derek, I think we could even have maybe something different for the sheriff deputies versus some other departments, because they are definitely out there more so on the front line. But we can discuss that further at the May 12th meeting. And certainly, commissioners, if you have a comment that you want to share with Bruce or Derek in the meantime, I would suggest you email them with comments on this. Couple quick things that were discussed at the last Board of Health meeting. The Lakeland Correction Facility over in Coldwater is us. Becky and I talked personally on it, and I encouraged her to contact the state. That is not a local problem, and it was becoming such since that is a state facility. I'm not real sure how far she got with them on that, but she is assisting them. Health department is assisting them. They are testing each and every individual. A large portion of the cases in Branch County are now believed to stem from exposure by the correction officers, and then they bring it back out into the public. Last count that I was aware of over to Lakeland was well over 400 positive. They are still testing. There is 1,400 in that facility. So it's just catastrophic in there. So just for information, I guess. Jackson facility is not much better. So that is a local issue, but yet it is for us in a way here as far as the health department. The other thing we briefly talked about that I think is of interest, and I'm sure everyone's seen on the news, there is no shortage of beef. Trust me, I've got some. And a lot of us have got animals that need to go to market. The problem is the markets aren't moving because the processing facilities are, some are closed, and some are operating at 30%, capacity. So don't go out and hoard beef. I mean, it's there. It's just that it's going to take a little longer because of some of these plant shutdowns. There's one in Indiana that just shut down today. They're expected to be closed for 2 weeks. There's one in Battle Creek, Kalamazoo that's closed. They expect to open up soon. Packerland in Green Bay had to shut down temporarily, sanitize, and the list goes on. Locally, we have Clemens there in Coldwater. We have Evans, and I'm drawing a blank on the one over by Quincy, but in any event, the health department is working with all of them for best practices, masks, and trying to keep, our local processing plants going. But
Mark, I have a question please?
Go ahead.
I understand that obviously this is COVID-19 related, that the plants are shutting down, but what specifically is the issue?
Well, the issue is the workers. Quite frankly, and under one of the governor's EOs, they can't be fired for staying home if they choose not to come in for fear, of being exposed. And so that's a small portion of the problem. Some workers are just staying home. The other part of the problem, or the bigger part of the problem, is there was a plant or is a plant, I should say, out in South Dakota that out of, I think there was in excess of 1,500 employees in that plant, and 400 and some odd of them tested positive.
Okay. Because everything I've been hearing has been that there's a problem with pork plants. And I didn't realize that, obviously, as you're saying, it's affecting beef also.
Oh, yeah, it's pork, chicken, beef, the whole works. As a matter of fact, on the news this morning, Ruth, there was a chicken facility that has reopened, and I didn't catch where, but they showed how they have now put like cellophane screening in between each workstation. They have provided all the employees with masks and with visors. And quite frankly, they've done an excellent job of providing a more, should I say, a better protected work space for their employees. And that's what's going to happen. There's just, normally in a slaughter facility or a processing facility, you're working elbow to elbow. They're just going to have to expand that space and probably slow the line down a little bit, and have less people with protective measures. But there is no problem, and I guess I need to emphasize it, there is no problem with the meat itself, whether it be poultry, chicken, or not. Well, poultry and chicken, same thing, but anyways, pork, poultry, or beef. The product itself is okay. It's just in the processing right now, and it's due to an employee issue, whether they're out because they're sick or they're staying home because they're afraid. That's pretty much the bottom line. So, but that's all I have, unless there's any further questions.
Mr. Just one quick question.
Go ahead.
In regards to the VA scholarship, did you say that the VA scholarship, the deadline I know was previously for April 1st, but has it been extended to May 1st?
Yes, May 1st. May 1st is the deadline. Yes, that is correct.
All right, thank you, Mr. Chairman.
Yep, thank you. Okay,
Mr. Chairman,
go ahead.
this is Brad Boner, and I've been listening in on the meeting. And Mary
Yes,
Beth
Brad.
had asked me to make myself available.
Yes, Brad, I will.
So just letting you know I'm here.
Okay, Brad, I appreciate that. We'll put you in the minutes as did you hear that we're gonna, Julie and Ruth are gonna get with you as far as interviews?
No, I hadn't heard that.
Okay, well, they will be getting with you within the next several days and conduct an interview either on the phone or Skype or some method. And then we intend on taking care of that appointment at the next meeting.
Okay.
Thank you for your participation, Brad.
Well, thank you guys. You guys, these are challenging times, and it sounds like our commission is doing a wonderful job to keep Hillsdale County running along at least at a good clip. maybe not as fast as before, but certainly keeping us up and going. Challenging times out there right now.
Absolutely, absolutely. Thank you. All right,
Thank you.
additional business, Bruce? Oh, excuse me. Public comment. I'm sorry, I jumped ahead. Bruce, if, hold tight a minute, please. So any other public that wish to comment at this time? I see we've got several callers that are listening in. All you have to do is press your on button and identify yourself and ask your comment or state what you'd like. Public comment.
This is Stephanie Kaiser, County Treasurer. I was just wondering.
Stephanie.
Good morning. I was wondering where my position to be filled is at.
We did not talk about that, and I know I had mentioned to you we'd wait until it's over, but if you feel safe with, I believe you had posted that internally. I believe if you feel safe with doing interviews via Skype or via phone, I see no reason unless there's a problem, unless we can probably do this by consensus. If no one has any objection, we can authorize you to get that posted.
That would be great.
Is there any of the commissioners have a problem, or are we good by consensus? Hey, Steph, you have it by consensus to get that posted and practice best practices to do your interview.
Thank you.
You're welcome. Any other public comment? Thank you for reminding me about that, Stephanie. I should have had that on today. Thank you. Any other public comment? All right, additional business. Bruce, you're up.
Well, thank you, Mr. Chairman. I just want to make the statement to the community that the Caswell household has had a few tests that we've had to run, and we went to the hospital and had them done, and they were very well. It was a very good experience. There's nothing wrong with going to the hospital if you need things, and I know people are scared right now and so on, but our experience at the hospital was very positive. The other thing I want to mention is going forward that we need to take a good look at what they did down in Florida. They have the oldest population in the country, and as of this morning, they've had about 1,700 deaths, 1,700, whereas New York City's had 22,000. And what they did early on was they got with all of the senior communities in the state and told them to stay home, stay away from things. They can golf, but they can't touch the pin. All of those types of things they did. They went into the nursing homes and provided protective, personal protection equipment, masks, and so on to all of the workers in the nursing homes. And they did that right off the bat. And they've had very little problem down there in comparison to other parts of the country. And as I said, they have a very old population. So I know there's starting to be some angst about opening back up and so on. And there's nothing wrong with getting the economy going again. That's fine. But the most vulnerable people we have are the senior citizens. And as we open back up, we've got to make sure those folks are protected and kept away from things as much as possible. Thank you.
Thank you. Ruth, anything I did?
Would just say that I'm dealing with a lot of very upset people right now that are just all very, very anxious, depressed. I had a call from somebody the other day that needed right now. You got to keep calm and carry on. Keep calm. This too shall pass. The unemployment will come through eventually. But you have to call. I live at Apple Run Apartments. I've lived here for 31 years. I have a lot of neighbors who are laid off, unemployed, have had to file and are waiting. And our management here has been excellent. They are forgiving late fees. They're just telling people not to worry about it. Wait until when your unemployment comes through, you can pay your rent then, don't worry. So if you talk to your creditors and the people that you owe bills to, most are being very understanding at this time. And that's what that's what our constituents have to do, you know? And we're here. I've been helping a lot of people, and I know everybody else has been too. But this is not the time to be attempting suicide or to be going overboard. We'll all get through this, but we have to keep our heads on straight and ask for help when you need help. I'm here. Everybody else is here to help. We're all helping each other. And we'll make it through this. So that's my message to the community.
Okay, thank you, Ruth. Namu, Ed.
Yes, thank you, Mr. Chairman. Yes, these are tough times, and we're just going to get through together. And my vision is that we will get through this with all of us together, and we will start counting our blessings.
Okay, thank you. Julie, thank you. Julie, you're up. Any additional?
Hear me, Mark?
Yeah, I can hear you now.
Okay, I had to call in on my phone. I don't know, my microphone was unmuted on my computer, but something's wrong, I guess. It stopped functioning properly. I'm just going to echo the sentiments of everyone else. The county is open, even though some of our offices are working with limited staff and limited hours. We're open. The commissioners are here for the citizens also. And please reach out if you have issues. All of us have been more than willing to help people with issues. I've been in contact with state representative and our senator and their offices, and am always glad to help anybody who's having an issue. And I've put out lots of notices in social media about where food's available and such. And so no one should be going without a meal or having trouble paying their bills. If they are, please get a hold of us and let us know, and we'll do everything we can to help you. Thank you.
Thank you. So one thing I'll close with that I heard on the news this morning, Oxford University in England has come up with a vaccine that they have tested on monkeys and introduced. So they vaccinated the monkeys, then they introduced the virus, and I didn't catch what the time frame was on the vaccine, but if it's like most vaccines, it takes 2 to 4 weeks for that to become remotely effective. So I'm guessing the time they introduced, was somewhere in that 2 to 4 week time frame, but the results have been pretty encouraging, is what they said on the news. So there is, I guess you could say, a light at the end of the tunnel as far as a vaccine. And I think we'll get through this and have a vaccine in a few years from now. This will be just one of many things that we've overcome. The list goes on as far as mumps, measles, TB. I mean, there's just a host of things that we as mankind have overcome, and this will just be another one down the road. But there is some encouragement coming out of England as far as a vaccine. So in any event, that's all I have. And with that, we stand adjourned and all for attending today.
Marnie needed to put your name on.